Oh,
There you go. You're good to go.
yeah, no, I'm not going to do that other thing. All right, well, yeah, it's great to be here and, and be included in this great conference. So I'm just going to speak very briefly along the lines that Oliver just started of talking about prevention and thinking about, what we learned during COVID, the COVID-19 pandemic. And so, what I'm going to talk about is one program that we developed right at the beginning of the pandemic to try to support the mental health of healthcare workers. So what happened was, um, you know, early on, I mean, I think actually Oliver may remember we were at a faculty meeting in the beginning of March of 2020, and people were talking about, what was about to happen, um, and because my group has a real interest in prevention, we've done a fair number of programs in young adults and adolescents. Um, it seemed like a sort of an obvious moment to think about developing something to support the group that may really, be confronted with, the tremendous adversity and stress, our healthcare workers. So, and we know from prior pandemics that frontline healthcare workers had elevated rates of anxiety, depression, insomnia, during the SARS epidemic, during H1N1. And then we've seen that also, obviously, during the COVID-19 pandemic. So during March of 2020, we worked really hard to put together this very brief online intervention, which I'm going to tell you about. And the goal of this intervention is to support psychological resilience, which is a word that's really been thrown around a lot recently, but I'll just define it here for you. Resilience is the capacity for or process of bouncing back or adapting during or following stressful situations. So we thought if we could provide at least even like an exposure to resilience enhancing skills or ideas, exercises, whatever we could, that this might be protective for healthcare workers who are about to really experience this major stress due to working long hours during this pandemic. But I just want to be really clear that we're not saying at all that everyone, can just learn some things and then be completely resilient during times of stress. One can be expected to bounce back or recover anytime there's a major loss or trauma or, uncontrollable events like this pandemic. But the idea is that maybe we can, boost our ability to manage stress so that these events, these things that happen in our lives don't have, really enduring negative effects on our self-esteem or our ability to function or, our mental health. And a lot of people have this idea, I've realized in talking about this, that resilience is like a fixed quality. Either you're resilient or you're not. You're born with resilience or you're not. And so just if I, sort of leave you with one point, I think it's very clear from the research and even just the research that we've done that we know that resilience is not a fixed thing, that it actually can change. And sometimes they can change by just learning certain kinds of skills that improve sort of like moment to moment resilience. So what we did was we are actually collaborating with two other groups at Mass General. My group, one of my groups, as Oliver said, I'm a co-director with him for the psychosis program, but I also direct this program called the Resilience and Prevention Program. So we were collaborating with the Benson Henry Institute and also the bipolar program at Mass General to come up with a menu of interventions that we offered to healthcare workers in our system. And we've made these interventions more broadly available now. So we made our interventions were delivered via this platform at Mass General called HealthStream initially, and then we've sort of uploaded them to YouTube so that they're more, and on our website, they're more broadly available. So I'm not going to go through all of these interventions, but I'll tell you a little bit more about the one that we sort of led, which was called Resilience Training for Healthcare Workers. It consisted of 3 12 to 20 minute long videos.
Oh, we lost you for a second there, Daphne. Can you hear us? You're muted.
Can you see me now?
Yes.
Okay, great. Sorry about that. Okay, well, so our intervention will focus on mindfulness, cognitive flexibility, mentalization, and self-compassion. And you can see, the entire intervention on the website that's shown here. I'm not going to talk about all 3 of these, but I just want to highlight self-compassion because that was sort of a particularly popular component of the intervention. And I also, before I go on, I want to sort of highlight some of the people who contributed. You can see we had a really large, kind of amazing team of people who just jumped in to help as soon as we asked them. It was incredible. And, Annie Burke and Nicole DeTore were the 2 people who really pulled together the materials and were really responsible for the content of the intervention. And then our filmmaker, Roberto Mighty, was the person who created the videos, and he was amazing. So as I mentioned, we focus on these 3 skills, and I'm just going to show you a little clip of a nurse talking about how she practices self-compassion.
Hi, Daphne. Before you do that, just so you know, your slides are no longer shared. They clipped off when your video clipped off.
Oh my God, sorry. Let's see, where is the Zoom? Okay, can you see it now?
Yes, yes.
Okay, good. Sorry about that.
The thing I've probably been hardest on myself lately is not being a present parent because I'm so stressed out. So when my kid wants to sit down and do Legos with me, and I'm irritated that she keeps saying mom because I'm trying to check the news on my phone, and then my mind will drift to what's going to happen to my family if something happens to me, that I can't even be present. So here I am worried about not having my family, but then when I'm with my family, I can't enjoy them because I'm so nervous about what's going on. So being hard on myself and not being able to just appreciate what I have right now, that's difficult for me. And I absolutely know that a good friend or even God would be like, you're doing the best you can, These are really hard times and you're doing the best you can.
So that was a sort of an example of thinking about self-compassion during a time when one is being, particularly hard on oneself or more self-critical. And, this is a skill that, really makes a big difference in terms of reducing people's stress and, anxiety. Sometimes people feel like, it's self-indulgent, or it somehow is letting themselves off the hook, but it actually helps people be kind of more effective and more productive than they were previously. Anyway, so we collected some data while we were, running this intervention, and you can see here that the people who received the intervention, their ratings of resilience are plotted in purple, and you can see that their resilience went up and it kind of stayed up after the intervention. And similarly, for the ratings of symptoms went down and stayed down after the intervention. And the people who didn't receive the intervention, and their scores are plotted in orange, they didn't show those same effects. So I think what this whole thing highlights is that kind of a very brief targeted intervention, just delivered online, you know, with no real interaction or anything like that. Even something as kind of limited as that can actually make, you know, a difference. And so I'll just end by mentioning that we are continuing this work, and we have this new program, which we call Reconnecting to Ourselves and Others in Virtual Meetings, or ROOM, where we're doing this similar kind of work, but we're actually doing it in a virtual reality environment. And we've actually had some healthcare workers do this already, and it was actually really well received because there's this added benefit of anonymity. You're also with other people in a way that Zoom really doesn't provide. You know, you actually are in an immersive environment where it feels like you're actually with other people. This is something that we're just doing now. And the idea is that, you know, even though the pandemic is you know, ending in many ways, you know, the mental health sort of effects are still with us, and we haven't fully acknowledged or fully addressed, you know, some of the trauma that people have experienced. Many people, including, you know, people who are on the front lines of healthcare, experienced. So I think we have to continue to do this work. So thank you for listening, and I apologize for the technical glitches. And now I'm just going to hand it off to Catherine Sabella.